So my name is Tuilan Kombo and I'm a lecturer here at Roehampton University for adult nursing students, that is.
My name is Ashley Lutchman and I'm one of the senior lecturers in the nursing team here at Roehampton. I've been at Roehampton for a little bit more than a year now. Prior to being at Roehampton, I was working at another university in London, and I've worked in 3 universities now. So my background is I'm a community nurse, district nurse, community matron, community specialist respiratory nurse. So I've done quite a few things in my NHS career.
So before I joined Roehampton, I used to work for the NHS Trust as a senior education nurse for trainee nursing associates.
My first impression of Roehampton was the first day I came here, because my interview was during a pandemic. It was online, on a screen. So my first day here was February last year, and I was like, oh my God, this is in a park. And I remember Paul Newcomb telling me, oh, you have to walk through almost like a little forest to come here, to come collect the office. And it was actually quite lovely. It made a difference. Like, you wouldn't think you're actually in London. It's slightly different. And then when I started last year in February 2021, it was mostly a very small team, so there was only, I think, 6 members of staff, and I was like the newbie, but I wasn't really a newbie. I had worked in academia for a long while, but it was interesting because it was an opportunity, and I think that's why I took the job first time. It was an opportunity to actually make a change and make a difference. Usually when you work in institutions, everything is settled, everything is already set in stone, whereas here, because it was a new nursing department, it was kind of like, well, actually, this is an opportunity to make a change and make a difference and try to make things in the way I wanted it to be.
Only experience I had with Roehampton before was picking up a friend who was studying, I think it was law and politics. And I drove in through the front entrance. This is years before I actually started. I was at uni as well at the time. And I can't remember what we were doing, but I picked her up when she had just finished class that day. And I remember driving into the front entrance and thinking, wow, this is actually really lovely. But then later on, saw the advert about the lecturer position coming up. So I was already starting to think maybe academia would be the thing. So when the job advert came up, I really didn't feel qualified for it in the sense that I thought you needed to have quite a lot of things to be able to teach. But I think I took the leap of faith and emailed Paul Newcomb, who's the director of the programme, and that was the contact that was given on the job advert. And I kind of just said, hi Paul, this is me, I've seen the advert, this is what I can do, this is what I'm doing, it looks interesting. But do I actually meet what is required for this? And the response was very positive and encouraging. And so the rest is history. Has to be the students. Yeah, there's something that I've learned in the role where there's a focus on the student experience and making sure that their learning experience is great. And I kind of draw from my experience as a student. What was it that made me develop my academic writing? It was actually the feedback that I got from lecturers who had the time to tell me what I was doing wrong, but also tell me how I could do it right and kind of point me to different places. So I think knowing that the students have a great experience of my teaching or give me feedback on what it is that I'm actually doing right or wrong, it kind of creates that rapport, so that they're more willing, I think, to hear from me when I say, well, I think you could do this better, because I'm open to hear what they think of my teaching style and things like that.
Well, my favourite part of the job is actually the students. It's the students because we are basically training the next generation of nurses, and we have got this strong community flavour, which basically for me that's why I'm here basically, because I am such a champion of community nursing. And it's a pleasure really teaching people who actually want to go and work in the community.
In the clinical area, i.e. where we are now, the ward and the simulated places are really up to date. I don't think as a student I'll be learning in here and then go to a placement and feel out of place. So I think that's an amazing thing. And also when we have our mannequins, there are times in my lectures that I've incorporated a scenario as we do in clinical practice with other colleagues, and so those scenarios, the kind of things that we're looking for students to pick up about the patient, how to use the equipment, and the way that the whole environment feels, and that's speaking from an adult nursing perspective. I think prepares students mentally, because I think sometimes, especially if you've not done healthcare work before, you're pretty new to nursing, when you go in a clinical environment, it can be daunting, just the environment itself, hearing bells and seeing, a bed being made a certain way and things like that. But just to have that simulated environment in the university, I think is pretty good. And then from my side as a lecturer, I had the experience of delivering a lecture in the lecture hall, but there's the ability to actually record the audio and then have to put it online for students who want to listen back. And again, I think that's a fantastic example of the facilities that we have, not just in clinical area, but also in the ability to record live sessions for our students who want to listen back to a live lecture, for example, or who would have missed it, especially with COVID having been around. There are times when last minute somebody finds out they're positive, they've got to stay home, and they're panicking about, oh, I missed class, because there are some students who just have 100% attendance. And so, so those facilities help make the whole thing inclusive.